guys. Guys, my name is Joe. So I'm a medical student, and basically I put together a few more questions that you might see on the exam today. So I'm going to go through some. We're just going to go through some more questions. That might be the A2 the exam later today. I want to say thank you first off that we do. This is easy and interactive. It should be quick and easy. Hitting some more of the high yield topics. Thank you, Dr. Farina, Dr. Barres, and good luck to everybody later. So without further ado, I just have the question. You're going to see the question. It's going to have the answer already there. So we'll get right to it. You already taught, and Dr. Barres actually already went over some of the questions. So we'll work on those. Okay, so which are the components of the cell cycle? So everyone knows that the cell cycle is going to be G1S, G2 mitosis. So go Sally go, make cells. It's easy to remember it. So those are simply the components. You remember that there's a series of checkpoints.
Dude, what was that mnemonic again?
Yeah, so the mnemonic, to remember the order, is go, Sally, go, make cells. GSG, MC, right? So G1S, G2. So basically the cell's growing in G1, in S, you know that S is for synthesis. S goes with synthesis, so you're going to make DNA, and in G2 you're going to do the last checkpoint before you go to mitosis, before the cell splits. So in what cell cycle is most important for DNA replication? A lot of you already knew the answer, and the answer to this was S phase. S for synthesis, DNA. That's the only phase where synthesis is important. We know a lot of chemotherapeutic drugs target the S phase. Call that DNA replication occurs in the S phase. We have another question here, number 3. Platelet growth factors represent only one facet of platelet bioactivity. Whenever you see a question that's true or false, and it seems too extreme in one direction, or too good to be true, make sure you note that. So for this question, platelet growth factors are only one facet. Yeah, obviously, because we know that platelet growth factors are involved in more than just how platelets function in the body, function in growth, and cell division and such. So we have a function for fibroblasting, muscle cells, and glial cells. So exactly where's alpha-2 macroglobin produced? This is another important question. Alpha-2 macroglobin, you know that most proteins are always produced by the liver, but in this case, macrophages are involved with alpha-2 macroglobin. You can remember that with the M, and you know that you're looking for two things here, alpha-2, so liver and macrophages is going to be your answer. So macrophage locally produces alpha-2 macroglobin, which acts as a cytokine. So angiogenesis is a question. Yeah, SCF1 is not the right answer.
VEGF.
Right, VEGF, and there's actually two answers. So angiogenesis is the creation of networking of blood vessels. VEGF and platelet-derived growth factor involved in angiogenesis. So try to remember those. VEGF is vascular endothelial growth factor. That's probably the most known one. So VEGF, PDF1. Not stromal-derived factor 1. For our stem cells stop functioning, we will live approximately how long? So the answer is 1 to 2 days. I don't know if anyone else had trouble understanding why that was the answer, but we know that we have cells that have high turnover rates in our body, endothelial cells, cells of the gut, mucosa. Those are typically the effects when you get chemotherapy, you get nausea, because the cells in your stomach are dying, the intestines are dying. So 1 to 2 days is going to be the answer. So that's only one of the variable answers. 90 days is how long red blood cells last for. Migration of stem cells to different organs requires active navigation. What is this process called? So if you go through the answer choices to quickly divulge and understand why each is wrong. Chemotaxis is where cells are attracted to some kind of cytokine. Basically, it's cell migration. Cell anchorage is intuitive in itself. Cell anchorage is going to be where cells are anchoring down, localizing. Immunoattraction is another, I think, term that kind of goes with chemotaxis. Homing, homing just by definition is where stem cells are going to migrate to their respective organs. You just remember that as stem cells are trying to go home, I guess. Forgive me for not having a perfect explanation for every question. But I think it's good to see every question once. So calling form units is our means of how we count viability, count cells. So all 4 of these is going to actually describe it quite well. Culturing cells in media. That's you're going to culture on your agar plates or whatever media. They're they're controlled at medium temperature and time, so you obviously have an incubator, lower temperatures needed, viability, and measurement potential. When discussing ligands, which of the following is false? So only one of these obviously is false. Ligands are always going to be what binds to receptors, so it can't be a singling molecule, it can't be a cytokine. It is a singling molecule, it is a cytokine, it is not a receptor, it binds to receptors. So remember, ligands binds to receptors. So when you have like CD40 and the CD40 ligand involved in B cells, that's what it's ligand. The ligand binds to the receptor. So here's a really important question to make sure that I think everyone for the board exam it might show up. Hyperbaric oxygen, the mechanism involved with improving stem cell proliferation. There's a nitric oxide mechanism involved. The mechanism is not 100% clear, but we know it involves nitric oxide and hyperbaric oxygen conditions are allowing the proliferation and differentiation of the stem cells. So pure PRP, this statement, this is a true or false statement. Pure PRP typically has less of a flare, indicating that it is more efficient. It's false, so it goes the other way around. Pure PRP has more of a flare, indicating more efficiency. So that's just something to know. So the more the flare indicates more efficiency when we process the PRP. So knockout mice, Dr. Bress went over this too. Knockout mice is an important topic. Knockout mice, typically the gene is knocked out, so it's not going to be transcribed and expressed. So A is not describing this correctly. They're not lethally irradiated, but they are mice where the genetic sequence is altered, and they are also chimeras, which is where you have two separate genomes inside one organism. So B and C are correct. Direct cellular reprogramming is documented by the study. So we're going to see this one actually. Stem cell mobilization and homing are guided by which cytokines? So another cytokine question. Someone already answered earlier. Right, so we know that SDF1 and CXCL12 are pretty synonymous in cytokines in mobilization and homing. So remember, homing once again is the mobilization of stem cells to the target organs. They're going home. CXCL12 and SDF1 can be thought of together. CXCL12, you may have seen that as the one involved with HIV resistance. You have a mutation to it. So in talking about the other ones, IL-12 is always anti-inflammatory. It stops the inflammatory process along with tumor growth factor beta. Stem cell factor is not involved with this. All the following are true regarding the HIF limit. So this is just more facts to know. Basically, the HIF limit is just it's describing how much stem cells can proliferate before senescence or arrest. So the wrong answer here is that they divide 20 to 30 times exactly. Which of the following are correct regarding integrin? So remember, integrins are
Can you go back to the slide before? It's except.
Except? Oh, except, okay.
Yeah. Oh, I see. Okay.
So,
They finite number of times they multiply.
yes, I think they divide. I think the correct answer is 40 to 60 or 60 to 80,
Right.
if I'm correct.
Yeah.
Exactly right. So that's why
50
B is,
to 80.
right, 50 to 80. So that's why B is the incorrect answer, forgive me. Which of the following is correct regarding integrin? You may see a few questions regarding integrin. Exactly, integrin is very important in cell signaling. You should have an idea of what the integrin proteins are. This is just a very broad drawing. So they have an alpha and beta subunit. They're usually transmembranous, so there's an outside sticking out. Absolutely. So all these are true alpha and beta subunits. They're transmembrane and have a chlorine intracellular signaling. Concerning stem cell division, which of the following is false? So let's go through the true statements first. They can divide asymmetrically to get to two different daughter cells. One original copy as well as a second daughter programmed to differentiate. So retaining one original copy with one differentiating. But however, B, they can divide symmetrically, producing identical copies. So this exactly. So this would accurately describe these two accurately describe stem cells. Not always. The stem cell always divides asymmetrically. Exactly. That's the one false statement. Not always. which of the following are functions of integrin receptors? So another question again. So let's go through some of the questions. So integration of cytoskeleton, yes, they're going to link the cytoskeleton with the extracellular matrix. Cell migration, yes, they're involved in cell signaling and cell migration. Inside-out signaling and inside-out are exactly what they sound like, the outside in or inside out. Those are both mechanisms by which integrin functions. Let's go through a little bit about flow cytometry. You may see a question, and I don't know how often many of you work with flow cytometry, but remember that this is negative, positive, so you're screening out.
Gating was the question that I had a problem with it.
With gating?
What does the gating mean?
So gating is where if you were to screen out cells for, so if you want to just CD4 or CD3 cells, you can gate and search only for those cells, so you won't when you
on the machine.
Yeah, exactly. It's a setting. It's on the software, so you can screen out for those cells. So you're only getting the cells you're looking for. You screen out the other.
So this slide means that none of this above, it says that all of the following have properties of flow cytometer except.
Yeah.
And
So
it says all of the above.
yeah. So
it's
some
a
of them are
question.
wrong. Yeah, it's a problem. It's one of our problems. It's
So
one
the other,
The semantics.
the
Take out the word except.
four
You're wrong.
ABCD,
Take out the word
are they
except.
correct or incorrect?
Yeah. So
No, I like that.
so they all are correct. Yeah. There is no wrong
It's a
answer.
bad question.
So.
The only thing wrong is, I guess, you know, your
Word
pronunciation.
except.
Any questions? Does anyone have any other questions about this question? Okay. All right. So we're gonna keep going. It's- Right, so now we're talking about MSCs. MSCs, Kaplan is proposing to be called medicinal signaling cells versus so this might be just a recall question that you might need to know. So medicinal stem cells is the name. Immune modulation, correct. So in the new definition of MSCs, which is the role that is emphasized, we're talking about immune modulation, we're talking about cytokines, talking about how the way T cells and natural killer cells are influenced. So it's going to be immune modulation. The other topics are things that have already been discussed heavily by stem cells. I researched before. The immune regulatory function of medicinal stem cells is thought to rely on all the following. So yeah, right. So why are these all correct? So pro-inflammatory cytokines, IL-2, 3, 4, IL-1, IL-6, TNF alpha. These are all things that are regulated by MSCs. Prevention of T lymphocyte activation, so stopping autoimmune reaction, increasing natural killer cell proliferation. These are all things that the decently pro-immune regulatory. Just have more words there, basically what I just said. All the following are true regarding adipose-derived stem cells, except these are actually all correct. So they meet the majority of induced stem cell criteria. MSCs reside in proximity to the vasculature, and they exist as fibroblasts adjacent to the larger vasculature. So just make sure you guys understand the definitions. You're seeing a lot of questions about stromal-derived factor, MSCs, and adipose-derived stem cells. Make sure you know the definitions as well. Oops. Okay, so which of the following results in the meta-analysis of stem cell therapy on DM? So there's a study on diabetes, on treatment of diabetes mellitus. These are all true. The study, I have the citations in if you guys want to read about it. Basically, they saw that patients, type 1 diabetics, so insulin dependent, they're able to help regenerate some of the missing pancreatic cells and see that they're insulin independent for average 16 months. So it's actually very, very, very good. In the future, there will be a product which will be derived from power PRP products. True, that is something that are.
Can you go back?
Yeah, sure. That's true. Yeah, so it's true. Power PRP products is a possibility. So when producing recombinant DNA products, so in like a lab setting, E. coli is used as a replicating agent. True, E. coli is typically the model for replicating plasmids to be introduced in some organisms. When dealing with skin and aesthetics, which critical growth factor is usually missing is lack causes skin aging. So insulin growth factor 1 is the one that is the answer here. IL-6 is an inflammatory acute phase reactant, and the other two are not involved in. TGF is actually, it would be involved in pro-modeling. It would be something useful in modeling. So yeah, so the answer is IGF-1. Macrophages, so we're talking about macrophages. Sometimes you get a question about the M2 versus the M1 type of macrophage. In terms of tissue regeneration, what is the mechanism? The answer is release of arginase and ornithine. This is a fact to know. The pathway is a little bit more complex. But remember that type 2 macrophages are the more stem cell ones involved. And type 1 are the lining, the phagocytes, the ones that engulf bacteria. Here's an image showing that. So type 1, you can see phagocytosis, and M2 increasing autophagy and favoring arginase and nitric oxide. What are some benefits of using light therapy? Light therapy can stimulate mitochondria, reduce reactive oxygen species, help cells that respond with a lot of mitochondria, muscle cells, hepatocytes, cardiomyocytes, and transcription factors. So NF-kappa B, which Dr. Reed talked about, these are all correct. All these questions are very are positive, so the answer ends up being all of are correct.
Excuse me, on this slide,
Sure.
it says that benefits of using light therapy, and the last one is transcription factors in NFKB. I thought NFKB is a bad guy.
Yeah, but it activates the other pathways, so that was the reason. I had the same question during the exam.
Yeah, so I don't know if that's the right answer or not, because light therapy cannot induce.
It does, it
It
does,
does?
it does, it does.
Okay.
Because I attended the course on the biomodulation by itself for that.
And it does.
Yeah, and they are shown that it does increase.
So
And that records about
So
it.
that's it.
No, well, you do need some bad factors in order for the good factors to
There's
back
so
work.
like NF-kappa, so something like this cyclooxygenase pathways are activated instead. Not just like the cortisol stress pathway. There's other pathways. I think I have to go back and look at that though. Thank you for that.
No, there are papers about it.
Like exactly. All right, so go. Is that okay though for now?
Yeah, perfect.
Wonderful. Exposure to daylight or specific wavelengths. We see red and blue light used. Classically drawn as acne, eczema, psoriasis. I guess there's some more questions for you guys. So what is the true statement regarding angiogenesis and vasculogenesis? The true answer here is that vasculogenesis is the act of building new vessels through mechanism SDF1. Remember I said that angiogenesis was the networking of the vessels. Vasculogenesis is the actual act of creating new vessels. That's through SDF1. Angiogenesis is through VEGF and PDGF. So if you have to just remember one, you know the other. Here's just some definitions. Keep going. So which of the following cell signaling methods requires close contact? Endocrine, paracrine, autocrine, juxtacrine. So endocrine is where a signal goes down the bloodstream to act on another organ. Paracrine is where it acts nearby. Autocrine is where it acts on itself. Auto in the name. Juxtacrine, juxta is the prefix for near, so that's going to be close contact. So that's why the answer is juxtacrine. Here's just a little picture showing exactly what those are. Paracrine is from cell to cell. Juxtacrine is just nearby. Which is what differentiates them. Which of the following statements is false? The false statement here is that obese fat has more Treg cells than lean fat. So why is that false? Because Treg cells would be a good thing. It would control the autoimmune attacking T cells. And we know that lean fat has more Treg cells, more positive immune cells. So that's just the one that's false. That's the one that doesn't fit the picture. I think we have an image here. So just a quick image is showing lean versus obese. So lean has more Treg cells, Th2. Adipocytes has more like your acute inflammatory cells, Th1, neutrophils, and M1 and CD8, right? So all the following are considered Yamanaka factors except the following. So the Yamanaka factors you just have to, we're going to go through real quickly. So Yamanaka factors are these OCT3 4, SOC2, CLIF4, and CMYC. NANOG is the one that's involved, I think, with, I don't know. I think NANOG is involved in embryonic stem cells, and I have it wrong for that. But try to remember those three. I know this is kind of a rogue question. Autoimmune diseases are characterized by an overabundance of Treg cells. That's false. It's the opposite. You need the Treg cells to control. It's called your peripheral tolerance. This is not working. Sorry. Intra-articular saline injections can have a therapeutic effect on dermatology. True. So we've all seen that. I can show you the data if you like. I can show you the study, the whole methods and everything. In the world of regenerative medicine, all the following are true regarding parathyroid hormone, except which. So parathyroid hormone cannot transform white fat to take on the characteristics of brown fat. That's the only false statement. We know that parathyroid hormone is contra-regenerative in nature. It helps rebuild bone and cartilage, and it can increase number of stem cells in the marrow, but it cannot turn white fat into brown fat. That's wrong. Make sure you don't get that wrong. Brown fat is the one that's higher in mitochondria and ATP. White fat is not as metabolically active. It's used just for energy storage. So most allogenic cells, including umbilical cord blood, UVC, is immune privileged. RTX, right? So false. Recall that immunologically privileged cells, so it's important to know the ones that are privileged: the eyes, the placenta, fetus, testicles, CNS, and the androgen and hair follicles. That's why umbilical cord are not being privileged. Exactly. So mu cells is a new definition I had to go look at myself. They're actually found mostly in connective tissue, so it's not adipose tissue. Mu cells, non-cancerous endogenous stem, it's just an endogenous stem cell found in connective tissue.
Wait, can you go back?
Oh, that's the one I'm going around? Oh, okay.
They're also found in bone marrow and
Yeah.
Going around fat?
Yeah.
Okay.
but they're not only.
So they're not all.
Tissue was correct.
No, it says only.
Oh, yeah.
Okay, so I'll make sure I check that. Yeah, this one I had me a little confused, so I have to go. I'll make sure I get that one squared away. Thank you for that,
So
Doug.
what was before that?
Before this question?
Yeah.
Before this question is asking about allogenic cells and and if they would be immunoprivileged.
And your last point was about umbilical cord?
Well, yeah, it's in the question, including the umbilical cord. That's what I meant. Does that answer the question?
Well, I think the writing of this question is what informs the answer. Most allogeneic cells, you don't really need to consider that the next point is just distraction, including umbilical cord blood. Take that out, it's easier, very.
That's a good point. That's a good point, doctor. That's a very good point. Yeah, it kind of seems like a distractor because most allogenic cells, right, by default. Okay, so that's very constructive. Thank you for that. Is there any other follow-ups to the question? Okay. All right, so going back, so which of the following is not associated with increased number of stem cells? This is, you have to know the different types of nitric oxide synthase. The inducible synthase is not associated with increased number of stem cells. There's a table showing that the inducible is involved with immune system. So the eye can be associated with the immune system. The other we know that endothelial nitric oxide is involved in vasodilation. We saw a lecture about that earlier. Neuronal is involved in neural cells. But the inducible is involved with the immune system. Any attempt to analyze the cell alters the cell at time of isolation, thereby altering differentiation events. So this is going to be true when you take something out of its setting and you disturb that and perturb it, you can alter its fate. Listen, the next question is, which of the following may result in more efficient PRP production? Photomodulation, 4 degrees, so putting in 4 degrees centigrade and reducing plasma concentration to no more than 25%. Those are your correct answers. Red blood cells, increasing the ratio of red blood cells. We know the PRPs, by spinning it out, that's not going to increase the amount of PRP. So these are these three, so by default, it's A, B, and C. Well, that's clear to everybody, so we know basically a picture explaining why the last one is false. So shockwave therapy, this is just another question kind of elucidating the details. These are basically all things that help that's been shown to be associated with releasing more nitric oxide, vessel growth, migration of stem cells, permeability of the cell membrane, growth factors, and mitochondria. These are all positive things. And right. Concerning PRP, which statement is false? So in PRP, we know that in the platelets, they're alpha and dense granules. it's important to know that, it's important to not only know visually, but to know what's found in each. So the adhesion molecules are actually in the alpha granules. Yeah. So B is incorrect because those will be found in the alpha granules. Adhesion for alpha. Which of the following statements concerning alpha 2 macroglobin is false? So we've seen a few questions about this already. It's not released by MSCs. It is produced in the liver, can be produced locally by macrophages. We know that. And found in plasma, it's a plasma protein. Not released by MSCs. Remember, the only two things that release it are liver and macrophages. A cell that has pluripotent characteristics has an open chromatic profile. An open chromatic profile means it's euchromatic. It's allowed to be fully transcribed. So that's something that makes sense. If something's pluripotent and has multiple fates it can go towards, its chromatin is probably going to be more open and easily accessible. Which factor is responsible for antibacterial characteristics of MSCs? So the only one here is LL37. That's involved with the antimicrobial facets of MSCs. We know VEGF, IGF, and SCF1 are growth factors involved in other areas. Which of the following statements concerning somatic cell nuclear transfer? We know that this is somatic cell nuclear transfer is putting the DNA of another organism, of one cell into another, an empty egg. So it is a form of cloning. It can increase telomere length in the DNA. It's transferring the nucleus from one cell to a fertilized egg, and then the answer D is incorrect. The cells have the same DNA as the original nucleus, not of the thing you're inserting into. So yeah, it's the pathway, and we know the dog long that's how that was made years ago. Which of the following is characteristic of the MSC? Out of these four options, MSC1 is going back towards LL37 we talked about earlier. Is involved with the antimicrobial. MSC1, you have to remember that MSC1 is talking about antimicrobial properties.
What are the other choices? Those are for MSC2?
Just like in general, those are MSC. MSC1, I think, is like a subset. I think that I was doing some research. I couldn't find too much literature on discerning MSC1 versus another, but the fact that it's delineated MSC1 is what makes it antimicrobial. If it just said MSC, I think it would be all the answers. I think that's what makes it.
MSC2 would probably be.
And this is all three are correct.
MSC2 would be A, B, and C, right? Okay. So MSC1, remember, MSC1 has to do with the antimicrobial effect. That's important to mark. Which of the following statements are true concerning the T1 immune system? So T1, I understood this question as asking between T helper 1 cells versus T2 cells. So we know that Th1 cells are not involved with antibodies. Those are the acute ones involved with like phagocytosis. Th2 are the ones involved with antibodies. So I think that's why B is the correct answer here.
Yeah, but.
But see, T1 immune system is, it's again, it's not properly formed.
Yes, I agree with that.
You should say it's a Th1 or Th2,
I agree with
there's
that.
nothing like T1.
I agree with that. That's why I didn't really know.
But the other thing is, I have a problem with C because it's not really a rapid response. It is kind of a slow response because you have to form the antibodies, right?
For T1.
It doesn't say that.
No, TH2 would be.
Th1.
So this is saying which of these are
That's not
true.
involved.
Right, so A and C are actually false.
Okay.
Does that answer the question though?
Yeah.
Okay, so remember, this is just a reminder, Th1 cells involved with phagocytes, IL-2, interferon gamma, macrophages, that's what involved with. Th2, remember B cells, antibodies, that's the most important thing to remember. Term CD, what does CD stand for? CD stands for cluster, right, thank you, cluster differentiation, exactly. Does everyone remember that CD133 is involved with hematopoietic stem cells?
So how long are we going to continue?
Actually,
It's 156 and.
it's 1:56?
Till 2 o'clock.
What time is it now?
You have 4 more minutes.
4 more minutes. Okay, let's just do a couple more. All the following considered CD markers except, I know we had some discrepancy on this one, but so for this one, At our discretion, we'll make sure we get the right answer out. I did know that CD90 is typically a mature neuron, so CD34 and 133 are the ones. Everyone knows CD34. CD133 is the one you have to memorize extra. Low temperatures can enhance platelet activation, improving the release of dense and alpha granules. Yes. Yes. So we saw that 40 degrees centigrade was one of the measurement variables used. Cytokine involved in hepatic stem cell mobilization from bone marrow is GCSF. I think this kind of, if you look at the answers, it's the only one that makes sense. Granulocyte colony stimulating factors. So that's going to be your thing that's going to increase medical uses. All right, guys. Thank you very much. I hope that helped a little bit.